Our next speaker is Delia Sosa.
Hi, everyone. Thank you so much for having me. My name is Delia Sosa. I am both a patient and a medical student, so I've had kind of an interesting perspective being on both sides of some of these stories. So I'm going to actually share the title of my story first because I think it adds a little bit of humor. It's called Being Trans Didn't Break My Arm. For the first time in a 10-minute conversation, the rheumatologist I had waited almost a year to see asked me, "So did you start testosterone before having top surgery or not?" I had gone to see her for a workup of possible lupus, which had been suspected by my previous PCP based on lab results and a detailed history and physical exam. And for the fourth time in this rheumatologist visit alone, I answered, "No, I have not been on testosterone. I'm supposed to start in December." After conducting a physical exam, mostly focused on my joints, the rheumatologist said, "I don't think there's anything wrong with you. You don't have synovitis, so I think it's unlikely you have lupus. But I want you to see a dermatologist for the rash on your cheeks, and don't start testosterone. It will muddy the picture for their diagnosis." I was a bit taken aback that the absence of one nonspecific symptom could almost completely rule out this diagnosis, and unconvinced that being on testosterone would make much of a difference in terms of figuring out why I had been so sick. But I got my blood work done, put my trust in the only rheumatologist I could get a referral for, and hoped for answers. A few days later, those answers never came. Instead, about 100 questions overwhelmed me as I read my lab results. The knowledge I had gained as a medical student gave me enough insight to know that something was wrong, and I could only break out in uncontrollable laughter reading my lab results. My ANA, which is antibodies that are targeting the nuclei in my cells, was very high, visible on a microscope even at a high titration, with staining indicative of an autoimmune condition in 95% of patients. Two inflammatory markers, my erythrocyte sedimentation rate, or ESR, and C-reactive protein, or CRP, were also high and at a level common in autoimmune conditions. To round out this clinical picture, my symptoms around that time were so unbearable, I once again could not leave my bed. My attending physician mentor from medical school even looked at the labs with me and expressed that with my symptoms and lab results, she was convinced I had an autoimmune condition. And yet, the day after opening the lab results, I got a call from the rheumatologist saying that my labs were, and I quote, "perfectly normal," and that I did not have an autoimmune disorder. Between this phone call, the dismissal of gender-affirming care as unimportant, and the conversation with my attending physician mentor in which even she was concerned, I knew I needed a second opinion, and I was not okay. It was in this moment I realized that I had been diagnosed with a form of trans broken arm syndrome. This is medical gaslighting, but specifically for trans people. When we talk about trans broken arm syndrome, typically it refers to blaming someone's illness or injury on our gender identity and or the gender affirming care we receive. But it can also take the form of invasive lines of questioning about gender identity unrelated to a person's care, as well as not being believed because we are transgender. It can become so intense at times that we may begin to gaslight ourselves as patients. Even in my case, as someone with more medical knowledge than the average person, I found myself questioning whether I'm even ill at all, despite being in pain and bedbound for a good bulk of the past few years. I distinctly remember thinking, "Delia, did you make up your pain? Did you do something to make your ANA higher?" As if I actually knew how to do that. I had been sick even since before I had top surgery, so how could my gender have played any role? Being both a medical student and a patient has shown me the severity and extent of medical gaslighting and trans broken arm syndrome many of us face. I've read and heard stories of transgender patients being unable to access even basic primary care, never mind specialty care. Trans patients being gawked at by healthcare providers because the organs they had did not align with the expectations of the providers. Trans patients being told that they're perfectly healthy, aside from the gender identity that their providers morphed and warped into an illness. I decided to go to medical school to change this narrative so that trans patients, trans people, wouldn't have to worry about being turned away or gaslit by providers who don't know how to care for us. And yet somehow I too was turned into one of the patients with trans broken arm syndrome. I succumbed to the exact harmful phenomenon I've worked so hard to fight. This is why I share my story, because I am by no means the only trans person living it. I am one of far too many trans people whose providers let life-saving, gender-affirming care get in the way of their clinical judgment. This is why I am training to become a physician, so that more trans patients have a provider who will see them as their whole selves, not as their testosterone or estrogen prescription. This is why I am an educator, so that more providers will have access to the training which allows them to create clinically sound, non-judgmental clinical spaces for their patients. I exist in medicine as a future provider to bridge the gap between healthcare professionals and the transgender community. Transgender people keep falling through this gap, and we have broken bones and bruises to show for it. To this day, I still have not received a diagnosis. I am in the process of piecing together what is happening with my body, and it will take more visits with specialists, a surgery, and even more time to figure out what is going on. But through all of this, I know for a fact that my identity is not the problem. Yes, my body has broken, but no, being transgender did not cause it.
What a powerful statement of not just activism, but you've just opened the horizon to an entire additional community that we must respect and care for. Thank you, Delia. Thank you. And, you know, there are many presenters to come, and we're going to try to hear from all of them. Because we need to hear your voices, but we are getting low on time. So Jamie, you figure out how we're going to get to all of our speakers.
Yes.